Okay. Good morning. I'm Sheila Williamson. I'm sorry, I made the chat too big and I can't see the screen. I'm technology challenged. I'm a clinical psychologist that works at the TK Martin Center for Technology and Disability on the MSU campus. I've been here about 2.5 years, but before that, I've done a little bit of everything in the state of Mississippi since I moved here 40 years ago. That's a New Jersey accent you hear under it all. So that's what that is. It doesn't go away. But I've been residential in schools. I've done Head Start consulting. I've just and I've been in private practice. So what I try to do is be practical. And so kind of what I'm talking about today, I sometimes worry that doesn't feel practical, but it's sort of the first step in understanding behaviors. You can do the slide, please. Because I think sometimes we seek to change and modify somebody's behavior because we deem it inappropriate. Okay. Like, this is unacceptable. You can't do it, which is great. Like, my goal is always that you function in whatever setting reaches your greatest potential that we teach you the skills you need to function there. But I can't do that until I can't change your behavior until I understand it, is the shift I made many years ago. So I do try to figure out what's going on before I figure out what I'm going to do, because those factors tell me if this is going to work or not. Okay. So when we start talking about the environmental factors, because sometimes I know teachers and support personnel are like, we just want to know what to do with this kid. And I think the frustration comes in is if we just kind of give you ideas sometimes and don't know some of those factors that are impacting that behavior, it's not going to work, and people are going to get frustrated, more frustrated, because you've tried everything. So go ahead. You can switch slides. Oh, you did. I'm sorry. No, go back one. I'm sorry. So that's where I was given these, and a lot of people want behavioral strategies for the classroom, behavioral strategies for the individual. And I often want to jump there because I'm a fixer. That's why you become a therapist. But I needed to slow down and step into what was going on with that child. And it's been amazingly more effective. So I want to talk about some of those things. Go ahead. Next slide. Thank you. I broke it down into 4 factors that influence. So one factor is environmental, okay? Kind of long-term and really kind of important, right? In knowing how to approach this child and what might work. So there's low level of predictability, hectic or chaotic environment. That for some of our kids, that's kind of some of like, it's okay to do this here type of thing, and people get frustrated. It's a little more than that. It's like, I don't know who's going to be here today. I don't know who's picking me up. I don't know who's going to be at the house. Different expectations across settings. I work with one little boy now. When he's at his grandmother's, he can do this. When he's with his mom, he can do this. But he's with so many people, he can't predict. And so therefore, he just looks like he's wild. Many handlers. This is often seen in kids with reactive attachment disorder, that they've had a history of many people taking care of them during that critical first 6 months to a year when kids learn, somebody's going to meet my needs. Somebody's going to meet my needs. So I always tell the story. My sister adopted a child from Thailand, or 2 children. She chose to get children who were in foster care with one family than who had been in the orphanage, because many of those kids in the orphanage had many handlers and didn't get their base needs met. So, And that's, that's issues with getting those needs met. Attachment. Are mom and dad so busy, maybe are so consumed by their substance abuse that when I cry, they don't pick me up. They don't change me. They don't change my diaper. And as I get older, they forget to do the things I need, medical needs, emotional needs, a lot of parents, really young parents, a lot of times just don't know how to parent, like how to meet that kid where they're at. They want them to be a young adult and just do things. And exposure to long-term abuse and neglect, even if they've been removed, it's a factor. You're going to get food stealing and food hoarding and, a lot of other things. And depending on what that abuse or neglect is, kind of the way you go to handle that behavior might like be something that they were exposed to something similar, and it is very emotional to them. Also, so one of the things I wanted to do is ask somebody from this one really quick, I want to go into detail about one, and I was wondering if somebody would pick one. Nobody's brave today.
Can anybody look at one of these factors and pick one?
You can put it in the chat. I'll do one. Okay. So if somebody has been exposed to high levels of abuse and neglect, especially abuse, then sometimes those kids are really hard to be reactive to consequences, because nothing you can do negative, or like if it's a negative consequence, has any meaning to them, because the level of abuse that they've suffered somewhere else is so intense. And it just doesn't matter. And they're not used to getting anything anyway. So, and some of those kids set themselves up to fail. They're bad before somebody else can tell them they're bad and remove them. So that's kind of one of the things that we don't think about. Like, he's not responding to this. Of course, he's not responding to that. He spent hours in a closet, So I think that's a factor we have to consider. So next one. Situational factors. And I call environmental factors and situational factors kind of the compassion factors. As much as that behavior is annoying us, it's 100 times harder being that kid. Okay. And so basic needs, sleep and hunger. I've worked with so many people, like in clinic and in schools. The kid just hasn't slept all night and they're like trying to do regular demands. I don't know about you, but when I don't sleep all night, I sometimes can't do my regular demands. Or when I'm hungry. Hungry is one. And in schools and preschool and daycare settings, we like a routine. It gives us a peace. And we just have to be aware of those situations, because there are kids who are hungry that just I have kids that come here in the afternoon. They're like, I'm hungry. I'm like, I just gave you a snack. That's not the hunger I'm talking about. The kids you don't know that are getting fed when they're not with you. Okay. Medical factors that aren't being taken care of, changes in schedules outside of what's going on. They have a new setting somewhere else. That's my timer to remind me to hurry up. Exposure to a traumatic event, fear or anxieties, especially kids who are not verbal yet. If they're afraid of something or they don't understand something, it looks like fight or flight. And so it looks very behaviorally challenging. Cultural factors. One friend of mine told me her daughter just, told her when she started her school, she'd been in her mother's daycare her whole life. And her daughter told her that she was afraid of white people. And I was so glad my friend could tell me, because like we could figure out what's going on. Like, yes, she's only being cared by Black women. And she had some medical issues. And I said, and white women, were the people giving her shots. So of course she doesn't like them. So, but we don't talk about it. I do talk about it because I think it's an important thing to talk about. Provider factors. We're all going to have days when we're not on. Provider factors like the parent. What supports and resources do they have? What personal factors are going on? And caregiver factors. Like, you have to know where you're at. I had a foot issue the last 6 months of last year and was in chronic pain. And that impacted my interaction. And I had to stay aware of that, or I was going to get irritated and annoyed with things that are much more significant than they were. And I was going to be inconsistent in my presentation. And then caregiver factors. Are there support and resources going on there? Issues. So does anybody want to pick one of these? Nobody's brave. Okay. The easiest one for me is caregiver factors, because we had a mama here the other day and I walked out and she was out front of our building after our preschool, and she said, I said, "Oh, did your car break down?" She said, "No, Miss Sheila, I've never had a vehicle." I said, "Well, you get your baby here every day at 12 and you pick her up every day at 3. Like, what, how do you?" Oh, I get rides from people, or I Uber, but my Uber canceled, and then I had to pay an extra $15 because I didn't know this. So thank you for being brave and saying cultural factors. It's really important to me because we just don't talk about it. I think if I had been anything else, I'd have been an anthropologist, because I like to observe before I ever tell people what they're supposed to do, and understand. And so some of the cultural factors are just an understanding that in some cultures that the words used to talk to a child are not abusive, and that child understands that sometimes. And also just culturally that, there has to be a lot of trust a lot of times for things to be understood. Usually culturally, we're talking black, white, but also others. Like, I'm working with an Asian family, and in the Asian families, disability or not, males listen to their father. And so if you have severe behavior disorders, that dad was really struggling with that, to the point that he was using physical punishment to the point it was leaving a mark. And I just said, I'm a mandatory reporter. I understand where you're coming from, and I'll help you use this. And in where you're at, I have to report it. And he didn't. His child still gets services, because I said, I'll support you through, when I make the call, I'm going to tell them you're doing everything you can to learn how to handle this. There's not a book on it. And a lot of times when I do mandatory reporting, the only time I don't tell a parent I'm going to do mandatory reporting is if the child's going to be at risk. Like, I know they're so abusive, they're going to take them somewhere or something, to get off cultural factors. And so I just think that we just don't understand that sometimes we're asking kids to navigate a different set of cultural factors when they're working with different people. And there's from what I've observed, there's very judgmental about the way certain people handle certain things. And I just think, for me, it's the conversation, like, to have, like, this could be a variable in this child's behavior. Like I said with that one young lady, all of their caregivers have been Black women. Now they're in a room with like 3 white women, and they just, like, things that were done a certain way in the daycare, are not done that way. And it's just scary because, you get in trouble then for things that are in line with your culture. I went a little long, so I'm going to go quickly through the last two. The goal is always, and some of my colleagues don't have the comfort, I want people to get to the point that they're going to tell me that. Hey, Sheila, this is not going to work with this child because of these factors. Because then I'm tasked to get their input, but I'm also tasked with then figuring something out because I should have more than one way to figure this out. And that's a significant concern because it's not going to be done. The teachers don't have buy-in, and even if they did, they know it's not going to work. They live the movie, we take a snapshot, right? Developmental factors. I do see a lot of times when I go in if you have a child with like language impairment, I think, which is like the case today, sometimes our expectations are too high for where they're developmentally receptively able to be. And so just knowing that, because it helps you differentiate between won't and can't. Now, I don't sit and can't. It's not an excuse. It just tells me what to teach. I do hate the phrase, he knows better, because we all know better, okay? I know not to eat these Swedish fish on my desk today, but I'm a little stressed because I haven't finished a presentation because I'm not Michelle and I don't do things ahead of time. And so, I'm stressed by that and I know better. I know better than to let it go the last minute. Sometimes other factors impact all of our performance. And I think sometimes we don't think to give kids that grace that, teachers will say, he did it yesterday. I'm like, what? You did all your IEPs yesterday. Are you going to be productive today? No, I'm just not feeling it, And again, I don't want them not to feel it. I just want to acknowledge, hey, I know it's not a great day for you. I'd like you to try to do this again. And the expectation is you sit in your seat even if you don't do it. So go back. Next. And motivational factors. This is where I work now with most kids. I stopped trying to change them. I stopped trying to figure out what they were motivated to do. And then I used that to shape them coming to me. I was taught old school that you pull and force and all that. If I figure out what motivates you, you're going to come to me, you're going to decide. And that's that kind of independent functioning we want to go to. I would say most of us are motivated to what's the easiest, the most effective and efficient in the least amount of discomfort. So that's why kids go back to those same behaviors. They're effective and efficient unless there's a more powerful motivator. I have one boy who always acts like he's going to run out the door. And I just change up what we're doing and also call attention to the other kids. He's right back in his seat. Old Sheila would have run after him. It would have been a game. So, and that's harder to do. That's harder to do in a classroom. Now I have 5 or 6 in groups, but I don't have 20. So, talking about being practical. We can do the next slide so we can go. I know we're running late. So again, currently, I don't seek to change people's behavior. I do birth to adulthood. I seek to support them and find out what motivates them. So supporting them is those environmental factors. I tell kids, I know this is hard for you. I know this scares you. And I know you can do it because you want to make the smart choice, or you want to be, learn how to play with the dinosaurs. I motivate them. And it's so much funner and so much easier than it ever was the other way. Thank you. I'm sorry I went long.